Chronic low back pain is a widespread issue, affecting up to 20% of adults and often leading to impaired physical function, disability, and increased pain-related distress. Many people with chronic low back pain struggle with everyday activities that require spinal stability, which can significantly reduce their quality of life. The lumbar paraspinal muscles play a crucial role in stabilizing the spine during movement. When these muscles are smaller or of poorer quality, spinal stability is compromised, making daily tasks more difficult. This video explores how the size and quality of lumbar paraspinal muscles are linked to physical function, disability, and pain in adults with chronic low back pain. By understanding these relationships, clinicians can better identify which patients may benefit from general trunk exercises or targeted rehabilitation strategies. Let's dive into the science behind muscle morphology and its impact on chronic low back pain. Researchers measured the cross-sectional area and attenuation of key lumbar muscles, erector spinae, multifidi, quadratus lumborum, and psoas, using computed tomography scans. These measurements help determine muscle size and quality, with smaller size indicating atrophy and lower attenuation reflecting poor muscle quality due to fat infiltration. Participants underwent several performance-based physical function tests, including the 5-time sit-to-stand, 2-minute walk, 4-meter walk, active sit-up, and single-leg stance tests. Disability and symptoms were assessed using the Oswestry Disability Index, numerical pain rating scale, and pain detect questionnaire. The study adjusted for age, sex, and BMI to ensure accurate association. Results showed that certain muscle characteristics were modestly linked to walking speed, balance, abdominal endurance, and neuropathic symptoms. For example, lower erector spinae size was associated with slower walking, while higher muscle quality correlated with better balance and endurance. Study found that lumbar paraspinal muscle morphology was modestly associated with physical function and neuropathic symptoms in adults with chronic low back pain. Larger and higher quality muscles were linked to better walking speed, balance, and abdominal endurance, while smaller multifidi muscles correlated with greater neuropathic symptoms. However, muscle morphology was not strongly related to overall disability or pain intensity after adjusting for demographic factors. These findings suggest that targeting lumbar paraspinal muscles in rehabilitation may help improve functional outcomes for some patients. Clinicians should consider muscle size and quality when designing exercise programs, but also recognize that chronic low back pain is multifactorial and influenced by age, sex, and BMI. Longitudinal studies are needed to determine if interventions that improve muscle morphology can lead to meaningful improvements in patient outcome. The research highlights the importance of a comprehensive approach to managing chronic low back pain. Understand the associations. It's important to grasp the concepts of muscle cross-sectional area, CSA, and attenuation. CSA is measured by outlining the muscle borders on axial CT slices, including intramuscular fat, and normalizing to height squared for body size. Attenuation is determined by segmenting within the muscle area using a density threshold, with higher values indicating better muscle quality. Lean muscle yields higher attenuation, while fat infiltration lowers it. These measurements provide objective data on muscle health and are crucial for evaluating spinal stabilizer function. By analyzing these parameters, researchers can identify subtle changes in muscle structure that may impact physical function and pain. This approach allows for more precise assessment and targeted interventions in chronic low back pain management.